Good evening. Welcome to Let's Talk Health. I'm Jenny Englerth. I'm President and CEO of Family First Health, and I'm so pleased that you joined us this evening. Let's Talk Health is a series that's offered by Family First Health in partnership with the York NAACP and WellSpan Health. We're excited this evening to focus our time and dialogue around access to the COVID-19 vaccine, a really timely and important topic. This series is designed to engage community members with medical experts to get your questions answered directly. This is your time to answer your questions and to engage in issues that are important to you and to our community. Tonight, we're joined by some great experts that I'm really excited for us to dialogue with. I'll start with Dr. Letitia Cosbert, and I'll also introduce Dr. Oluwatomi Uwazota, Dr. Tomi as we know her as. And I'm going to share that both of them are alums of Howard College of Medicine, and also the York Hospital Family Medicine Residency Program. Both practicing family medicine physicians here in the city of York, Dr. Tomi with Family First Health and Dr. Cosbert with WellSpan's Community Health Center. We're so excited to have them share their expertise and be here to answer your questions. I'm going to turn our time over now to Anika Jackson, who's going to moderate our time together this evening. Anika is my colleague and so appreciative of her work to engage with community members about this important topic. So Anika, I'm going to turn it over to you to get us started this evening.
Thank you, Jenny. And I too am excited to have everybody join us for our second Let's Talk Health session. As you'll recall, for those of you who joined us in March, we convened in March and talked about building confidence in the vaccine. So we answered questions around the vaccine, the different types of vaccine that were available, some very nuanced questions about specific conditions. So this session is about access and availability. So to give us some basic information to get started, I want to walk through a little bit of data so that we're all working from the same place. So in terms of case rates, there have been close to 42,000 confirmed and probable cases of COVID in York, with 760 deaths. And that's as of 12 a.m. today. We're starting to see cases in the county climb again, which is a really important note for our conversation tonight. On the flip side of that, we're seeing vaccine supply has increased tremendously in the past month. Since we last were together, we've seen much more supply come into our community. And what that has allowed is more access for our community to get vaccinated, for those who wish to get vaccinated. We also know that, access in PA has opened up. The state had a plan to open up a phased approach, and they accelerated that tremendously in the past week. As of yesterday, we were opened up to phase 2, and that basically means all Pennsylvanians are able to get a vaccine should you wish to have one. So that has really posed some challenges for the healthcare system, but also some opportunities to really get more people vaccinated so we can move through this pandemic. As we look at vaccination rates in York, we have close to 124,000 residents who are partially vaccinated and close to 82,000 who are fully covered with both doses of the vaccine, of the two-dose series vaccines. However, we're seeing demographics of those who have received vaccines fall into some very specific and marked categories. Those being age 55 and up. The primary race that we're seeing vaccines fall is white, and then also non-Hispanic. And so that is something that I believe we need to get into a little bit tonight as well. We talked about last month. And so we know that we continue to see higher rates of COVID in our Black and Spanish-speaking communities, and that goes with our session from last month. So, tonight, as I shared, we're getting into availability and access. And I will share that Family First Health, and I think all of the health systems in this community are really working hard to meet people where they are. And we're taking a multi-pronged approach to meet people where they are. That could range from mass vaccination sites to one-on-one targeted outreach to those residents who are homebound. So we'll answer your questions tonight. As Jenny said, this is intended to be the session for the community. So please, throughout the session, please feel free to chat in your questions, call in with your questions. We'll put the number in the chat there, or email us, and we'll get those questions right to our providers and get you answers. This session is being hosted by Family First Health, but certainly in partnership with WellSpan Health and the York NAACP. So we thank those partners for joining us and getting this information to our community. So with that, I am going to turn it over to Dr. Tomi, who is going to answer a handful of questions that we've already received to get us started. But please go ahead to those in the community that are watching, start chatting in your questions, and Jenny and I will pull those out and pose those to our providers. So Dr. Tomi.
I am very excited to be back with everyone to talk about this very, very important topic of COVID and COVID vaccines. I would go right ahead to some of the questions that we've gotten so far, and hopefully we'll have enough time at the end to continue to answer all the questions that come in. So the first question is, why is getting the vaccine so important, particularly at this time? There are three, maybe more, main things that I'm going to highlight here. So far, we know that the vaccines are very, very effective in reducing the risk for severe COVID disease. And so meaning that the risk that you get really, really sick from COVID, the risk that you end up in the hospital with COVID, or the risk that you would die from COVID. As of about a month or two ago, that was one of the main things we could say with confidence. But over that time, over the past month, we now know that not only can you protect yourself from getting very, very sick from COVID, you can protect other people from getting sick from COVID. So people that want to, spend time with your kids, with your grandparents, by getting vaccinated, by getting protected, you can also protect them from getting really sick from COVID. About 10 studies or more have been done since over the past month that prove this, including a study by the CDC from last month that shows that after the first dose, you are able to prevent 80% of asymptomatic transmissions. So even if you don't fall sick because you're so healthy, 80% you can reduce the risk of you giving it to someone else by about 80% after the first dose. And after the second dose, you can reduce that risk by about 90%. So that is really, really fantastic news, which I feel is really, really compelling for me. The other reason that I want to highlight, we keep hearing about variants. The reason why we keep getting all these variants is because we still have transmission. The best way to really stop this pandemic is to reduce transmission of the virus. So if we don't want to keep getting all these mutations and all these variants, we really need to work on stopping transmission. And one of the ways to do that, one very effective way of doing that, is getting vaccinated. So this is one of the best ways to help us get to normalcy quicker. Like Anika mentioned, Pennsylvania is still one of the hot zones, unfortunately. Other places are doing, a lot better now. California, we see cases going down. We see cases going down in a lot of places, which is encouraging. But Pennsylvania is still a hot spot. So it is really, really important that we focus on all the things that we need to do to keep ourselves healthy and keep the transmissions low. Finally, I was going to mention that it is important to get vaccinated. I know that the Johnson & Johnson news came out recently, and we will still talk about that in a little bit. But we overwhelmingly, we still, all the data that we still have show that the mRNA vaccines, which we have, the Moderna and the Pfizer vaccines, which are still really available, we have a lot of supplies for those. Those have been, over time, are still found out to be quite safe. Very, very minimal risks of adverse effects from those. Even when you do get some adverse effects from those are short-lived, and most people are recovering without any issues. So those are the main reasons I'm going to highlight about why it's still important to get vaccinated. The other questions that came in, what vaccines are currently available? I just mentioned the Moderna and the Pfizer vaccines are still available. WellSpan has a lot of supply of those. Family First has a lot of supply. There are a lot of mass vaccination sites. You're still able to get both of those vaccines. As far as the Johnson & Johnson is concerned, I'm sure most of you would have heard the report about what happened that came out yesterday. The CDC and FDA, out of an abundance of caution, decided to pause the administration of the Johnson & Johnson vaccine. This was because out of the 6.8 million people that have been vaccinated, about 6 people developed a rare side effect that involves blood clots going into the blood clots in the brain, what we call the venous sinus thrombosis, associated with low platelets. The platelets are the parts that help people not to bleed. So that they got a lot of cases, 6 cases rather, not a lot of cases, 6 cases out of 6.8 million doses of that really, really rare side effect. And I think the system really worked the way it should. The science community was able to raise the appropriate alarm when they saw this, and they were able to put a halt while they do more digging and investigation, and while they spread information to healthcare providers and people about how to manage this. Now, am I worried about this? Not really, and I'll tell you why. The condition called the cerebral venous sinus thrombosis, it's not something new. It's something that has existed in the population. As a matter of fact, there are so many things, other things that we do that puts us at risk for that condition. Pregnancy increases the risk of that condition by about 10 times. Oral contraceptive pills increase the risk of that condition. With the J&J vaccine, this is something that is so rare that has only happened in about 1 in a million people. So when you look at other things, contraceptive pills, pregnancy, other things that we do every day, this risk is not so much higher than those things. As a matter of fact, I would argue that it is lower. So is it enough reason to completely run away from the vaccines that have shown to be very, very effective and overwhelmingly safe? I don't think so. I think the CDC, the FDA, everyone is doing everything we can to make sure that all these concerns are appropriately addressed. But I still think that, at least for now, while we are halting the J&J vaccine and looking at that, it's important to not let this scare us away from continuing to choose to get vaccinated. So I'm going to hand back to Monica, and I'll be happy to jump back in when we start getting the questions in.
All right. Thank you, Dr. Tomi. So, I know that the J&J pause is causing a lot of question in our community. So that was something that we had started hearing, understandably, and I'm glad, Dr. Tomi, that you could take some time to provide some accurate, fact-based information to our community. So I had seen that question come in already in the chat. So thank you for addressing that. So as we have other questions come in, I will toss those to the providers. So let's go ahead and get started with our Q&A portion. A reminder to those who are joining us tonight, feel free to chat in your questions, call in your questions, and email us. I know there's information in the chat our team has put in on how to reach us. So we'd love for you to use this opportunity to hear directly from our experts in our community. No pressure, ladies, to get these questions answered. So one of the questions that's come through already is, and I'm going to read this. So when I received my first vaccine at York Hospital's pavilion, there was a steady flow of people. For the second vaccine, few people were there. Has the number of people interested decreased, or was that a sign that the first tier of eligible recipients were complete? Ooh. So Dr. Tomi, Dr. Cosbert, who wants to take that?
I can take that. I think that's a question that we would have to have a little bit more information on. Definitely. It depends on when you did get that first vaccine. So that would tell us, was that timing later on where the steady flow of people, including people who were getting their second vaccine, in which case, and you were at the later end of maybe the first group of eligible recipients for it. And then that's why you had the second vaccine. The other reason that that could possibly have happened is that other vaccine sites did open up. And so people found themselves maybe going someplace closer to home, whereas originally they were driving further away to just get the vaccine as soon as possible. So that could also contribute to why it looked like there were less people. Anecdotally, at least, it seems like there's still a lot of desire for people to get it, and they're looking for places. I get calls every day for patients trying to figure out how to get it or wanting to get it earlier. So yeah, there could be a couple of reasons why, and those are just like two of the reasons why it may have seemed like there were less people at that time. What also happened was the timing between the first dose and the second dose did change at some point. So the spacing of it changed once the vaccine had already been rolled out. So all of those could have contributed to why it may have seemed like there were less people for your second vaccine dose.
All right, Jenny, it looked like you wanted to hop in there.
Thanks. I know I was muted and I didn't want to start talking on mute like I've done 10 times today on Zoom already. No, I think that one of the questions, and I'll paraphrase just a little bit, that it would be great to spend some time on. Last time we talked about the mRNA kind of construct of the Pfizer and Moderna vaccines. Just as people want to understand more about the J&J option, could either one of you talk about that difference and how they're constructed in a way that's easy for me to understand and everybody else, how it is different? And not to say whether that contributes or not to what we're experiencing now, but just so people have a baseline understanding about how this is a different option. Should this become available in the future so they have that information kind of going into making their decisions?
I'll take that question. So the three vaccines that we currently use in the US, like I said before, the Moderna and the Pfizer, and then the Johnson & Johnson, which we know what's happening with that. The Moderna and the Pfizer are mRNA vaccines. mRNA vaccines, they are a somewhat new technology in vaccines, but not a new technology to science in general. And we may have talked about this a little bit before from the previous sessions, but essentially it's an instruction for your body to produce antibody, to produce an immune response, to produce cells that can help protect you against the COVID virus. The mRNA is the instruction that the body needs to produce something called the spike protein. The spike protein is the part of the coronavirus that gives it that crown look that you often see on internet. So it's able to be made quickly because it doesn't go through a lot of the other processes that old vaccines used to go through. It's been very, very safe so far from what we've seen. The J&J vaccine, on the other hand, is what they know as a viral vector vaccine. So what it is that they take a virus that causes common cold, called the adenovirus, that causes common cold. They remove the ability for it to replicate, to reproduce itself in the human body, and then they put a different type of instruction manual known as the DNA within the virus, and this is really just to get it into the cell, because you cannot put the mRNA or the DNA into the cells by themselves. You need like a vehicle. So that non-replicating cold virus that has been stripped of all ability to produce disease is put in the body. Now, that J&J vaccine that uses that viral vector that I just talked about is quite similar to the AstraZeneca vaccine that is used in UK and other parts of the world. And we've seen that these really, really rare conditions that we're having with the blood clots and the low platelet has been an issue with the J&J and the AstraZeneca vaccine. Again, very, very different from the mRNA vaccines. They use a completely different mechanism to get their effect. That being said, if the J&J does become approved again, which I'm not going to be surprised if it does, I can't comment fully on it now. If it does become approved again, it would likely be because, again, these things are really, really rare, 1 in a million. And what we know has happened with the AstraZeneca vaccine in the UK and other parts of the world is that it was determined that the risk of COVID itself outweighed the risk of getting this really, really rare conditions from this viral vector vaccines.
Thanks, Dr. Tomi. Anika, what have we got next? I think we've got something around age, right?
We do. So what is the youngest age you can receive the vaccine? And this is an interesting question because there's some work in this area right now. So basically, who can receive the vaccine as of right now? What age?
16 and up right now is what's approved for the vaccine. So 16 and older.
And Dr. Cosbert, we were having a conversation with another group earlier today, and someone said, when is it going to be available to younger kids? Do you see that on the horizon? Or are you hopeful that you'll see that on the horizon?
I think we're hopeful, at least from seeing how it spreads in schools and such. We do want to be able to protect both students and teachers. But as of right now, especially with clinical trials and what we've been doing, it's been focused on adult. And so just as we don't want any adverse reactions to happen to anyone, especially we don't want it to happen to our children. And children do get affected by coronavirus. Thankfully, mostly them is less severe of a disease process. So hopefully if we can protect a majority of adults 16 and over, then we confer a larger immunity and protection for everyone and can start looking towards something like that. But that would be the dream. Everyone vaccinated.
And Dr. Cosbert, just so people aren't confused, could you describe because there's a little bit different age category for Pfizer than Moderna, correct?
Yeah, so the Pfizer vaccine is 16 and up. Moderna, I believe, actually,
18.
It should be 18 and up, yes.
So just if someone calls to make an appointment for the young person in their lives, if it's a facility that's using Moderna, they'll get referred to another facility where Pfizer is available for a 16 or 17-year-old.
Yes.
All right. And so as we talk about young people, there was a question, and I think this is going to become more relevant as the weather gets nicer. So the weather is getting nice and people want to participate in large gatherings. Is it safe? And we know that CDC came out with some guidelines about those who are fully vaccinated. So, Dr. Tomi, do you want to dig into that?
Yes, sure. I think there's a lot of positive news on that end. Um, we obviously still need to be careful, but I'll go into some detail. Following what we now know about the ability of these vaccines to prevent us from even spreading the disease. The CDC came out and started releasing a little bit of restrictions on people that are fully vaccinated. So 2 weeks after you've gotten your Pfizer or your Moderna doses, which are the 2-dose shots, so after you've gotten the second dose of the Pfizer or the Moderna, 2 weeks after that, you're considered fully vaccinated. And 2 weeks after the Johnson & Johnson for people that have gotten the Johnson & Johnson vaccines, 2 weeks after the Johnson & Johnson, you're considered fully vaccinated. People that are fully vaccinated can be inside a house, can be inside homes with other people that are fully vaccinated without masks. So that is definitely something that they've given the check mark. People that have been fully vaccinated can be with one household. So not a whole lot of people that are not unvaccinated. So if you have one household that is unvaccinated, someone that is fully vaccinated is considered safe to be with them. We still want to avoid large crowds, close gatherings, or places that don't have good ventilation. So you still really want to avoid that. It's hard for now to know who is vaccinated or who is not vaccinated. So we're still asking that if you are in public, please wear masks, whether or not you are vaccinated. If you're going to public facilities, restaurants, things like that, please wear masks still, just because I think that's the considerate thing to do. That's what the CDC is still asking that we do. We also know that people can now travel if they're fully vaccinated without going through the quarantine. So if you're coming into the U.S. traveling in between states, you don't have to quarantine if you're fully vaccinated. If you're going to other countries, you will have to follow the directions from those other countries.
Okay, sounds good. So even though folks are fully vaccinated, we still need to wear our masks. There's still guidelines that we need to follow. And I think that's what this question was really getting at. Another question that came in was, is there any other vaccination that is available that has used the mRNA process? So Dr. Tomi, you gave us a really great explanation of how the difference between the viral vector and mRNA, but can you give us any examples of other vaccines that use mRNA?
So, like I said, mRNA technology is not new. It's been used in in medications. They've been trying to think about it at least since about 2002, probably earlier when we had the first MERS, I believe, pandemic. So it's been in the works, but it wasn't particularly used in vaccines up until COVID happened. And when COVID happened, they already knew a lot that they needed to know about making it work in vaccines. So it was building on several years. It was building on several years of known information about mRNA. And part of what they were working out, all this time was, yes, we know that this is something that will probably work, but how do we get it into the human cell? So figuring out how to make it stable, how to put that fat bubble around it so that it's stable in the human cell. That's all they've been trying to figure that out. Again, this is the first time it's used in vaccines, but we've had almost 6 months at least of people getting the mRNA vaccines now. And so far, we are still seeing really good results. The science community was really blown away by how effective it's been. and how safe it's been so far. As far as the viral vector vaccine, that is not new at all. That was actually used in the development of Ebola vaccine, and it was used in a lot of people, including pregnant people, in other countries, and I think in the trials in the US as well. So that technology is not new in vaccine. The mRNA is the one that is a little bit new in vaccines.
Great. Thank you, Dr. Tomi. And so I think that the next question that has come in, you touched on part of this. So if we are fully vaccinated, can we pick up, carry, or spread COVID?
Right. So I touched about on that a little bit, but I'm happy to go over it again. You have significantly less risk of picking up or spreading COVID. That is not the same as zero risk, but significantly less after you've been fully vaccinated. So the studies that we have so far have given us anything between 60 to 90%, but the one that was done in the US last month shows that you are 90%, you have 90% less risk of spreading the disease. Because I said no risk, because I said it's not a 0% chance, I still would encourage you to please wear your masks whenever you can, socially distance whenever you can, wash hands, all the common sense things we still need to keep doing.
Thank you. So the next question is a specific question about a particular condition. So this question is someone who has lymphedema in all of this individual's extremities, and they said that subsequent to being vaccinated, this person had heard that folks who have lymphedema should not receive the vaccine because it could aggravate that condition. And so is this true? And then what does that look like for a potential booster in the future? And I know this is a very specific condition.
Yeah, it's a very specific question, and it's very interesting. As far as I know, the only contraindication, absolute contraindication to getting vaccinated is if you've had a severe allergic reaction to your first dose of the vaccine or any ingredients of the vaccine that you got. Now, would you describe lymphedema as a very, very severe reaction? I don't know what response to give to that. The way that the CDC FDA describes severe reaction is something like anaphylaxis, which is where the throat closes and you're short of breath. If you are someone that has that particular condition, the lymphedema, and you're very concerned about it, about getting the vaccine again, I would encourage you to talk with your primary care doctor to make that decision. In very, very, very rare cases like that, when you've decided not to use the one vaccine because of a severe side effect, they're telling us that in that very, very specific instance, they're able to offer you a different type of vaccine. But with the J&J, that's something that is like a moving target at this time.
Yeah, and I second that. Again, if you've already had the condition and you received the vaccine and you did well, I'm seeing if there was an issue about like booster shots. That wasn't a contraindication that either of us are aware of. And if you didn't have side effects from your first round, and I guess booster shots is something we're going to talk about soon too, then I wouldn't be as concerned. But again, that is a conversation to have with your primary care doctor, who should be able to help you kind of mitigate those risk factors and decide what's best for you.
Dr. Cosbert, you kind of just touched on it, but there was a specific question about booster shots or, additional annual vaccine? We've had some questions in the past. Will this be like my flu shot annually? I know you don't have a crystal ball, but would you be surprised if we needed a booster or this became something annual for a period of time?
Yeah, I mean, personally, I wouldn't be surprised. Right now, and I think this is what's been a little bit, difficult for the public as well as for us in the medical community. We're learning it as we're going. Everything is sort of in real time. We're all doing this together. We're really learning it almost the same time you guys are as we're moving forward. So, right now the vaccine trials, the phase 3 trials, so the people who volunteered and were vaccinated initially, they're into their 6 months and it's showing really good efficacy still. But we have to, or actually a little more than 6 months. So we have to see what the antibody levels are going to be looking like and what the data is going to show and what the trends are showing before we see, is there going to be a booster? And then that will also depend on what the virus looks like. Will we need a booster because of changes to give us more protection to whatever's the more prominent strain at that time? So it's a little bit of a unfortunate weeding game as we go forward. But again, just reiterating that we need to continue doing what we've been doing, staying safe and not taking risks, getting vaccinated so that we can have some more of those freedoms, and then being able to do whatever the next step is to stay as healthy as possible.
I'm going to add to that there's actually ongoing studies. Pfizer is kind of working with modifying their vaccines to address the upcoming variants. I know before this pause, Johnson & Johnson was also working on a trial to check for a booster shot. Like Dr. Cosbert said, all this is really a moving target. There are some scientists that really think we wouldn't need one because people do get not just antibodies, but other killer cells that help, called the T cells, that provide additional long-term immunity. And so far, those responses have been seen to be strong. Some people believe we would need it. Some people don't think we will. It really is a moving target. So that's a wait and see type of answer.
I appreciate your responses, and we all know that it's easier said than done to kind of been at this for over a year. And for those of us that don't live and breathe this every day, this time of kind of following the science and understanding that this is a new pandemic and a new disease that we've had to, as Dr. Cosbert said, kind of learn together. So when I kind of frame that through that lens, and I think about some of the areas of questions and concerns that people have about vaccines, what's your strongest case from both of you as to why someone should really take this leap? And that's what it feels like for a lot of people, to take a leap of faith, to move ahead with vaccination and kind of continue forward. And so while we have better access than we've had so far to vaccine, we want to make sure that people are queued up. We're obviously here in support of getting vaccines to everyone that's eligible. But for that person that's kind of sitting on the fence, I'll start with you, Dr. Cosbert. What would you say to maybe help that person be empowered with information to make the healthiest choice for them?
Wow, it's so interesting. So my father was definitely one of the, I will never, he doesn't get anything, no flu shots, nothing. And was just like, I'm not going to do this. And then surprised me and actually got his vaccine. And for him, it was a lot of, I can't rely on someone else to protect me. I have to protect myself from this. And he's an older gentleman, of course, has a couple of other medical conditions, and he enjoys having somewhat of a social life, at least just going grocery shopping. And he realized that that is his thing. He realized that, there is a risk that he's taking going out to the Costco every week or whatever. And he really, especially as people are getting a little bit more fatigued, a little more tired with it, wanting to do more, that we have to be able to protect ourselves as well. And this is something that allows us to protect ourselves. And so he took that saying, I'm going to do this for me at this time. And then he can also protect his grandchildren. And in knowing that he could also do that for them, and be able to see them, especially with schools going in and out, and some in person, some virtual, so that there wouldn't be those restrictions for his life, that actually it expands what he can do with socially, and if safely though. The other thing is, our baseline is this vaccine could stop you from having a very serious complication or become seriously ill where you have to go into the hospital. Unfortunately, the hospital right now, depending on the numbers, sometimes you can have a visitor, sometimes you can't. It's not really, I don't think anyone ever wants to be in the hospital, but as of right now, it's actually it's more challenging. And you get even more isolated from the people you care about. So this is a chance to not be in that position or put someone else in that position. So those are two good reasons. I think at the end of the day, I think, everyone is worried about side effects, but it is a risk benefit that you do have to think about for yourself. Side effects of a vaccine being achy, maybe not feeling too great for 24 hours, needing to sleep it off, versus possibly having a severe case of COVID-19. So.
Thank you for sharing that personal story. I really appreciate it. And, everyone kind of has their own motivators, and sometimes hearing what those are resonates with people. And so thank you for sharing that. Dr. Tomi, what about you this evening? I know you shared a little bit with us in the past conversation, but you've continued to talk with more patients, your own experiences evolved. What's your perspective this evening?
So before, one of the small hesitations that I had at first, before I got my vaccine, was even when I had this false sense of security that I'm young, I'll be fine. But then we started getting more people that were young, especially African Americans, that were young, getting COVID and getting really, really sick from COVID. What would have been a stronger motivation for me at the time was if I knew that I could protect somebody. And I think that that's a really strong motivation for a lot of people. We couldn't say that before, but now we can. The moment I saw that, I was like, if I knew this then, I would not even have waited a second, because I know that me getting protected, me getting vaccinated, protects my 3-year-old son cannot get the vaccine right now. So that was really, really strong for me. Also, I'm quite fascinated by numbers. I'm a little bit of a nerd in that way. I looked at a couple. I looked at a couple of graphs. When you look at a country like Israel or even Michigan or even here, you see how this drastic drop in the numbers of deaths and hospitalizations, including in nursing homes where people are really, really sick. You see that drastic drop when you look at those graphs. Take some time, Google it. You will see these graphs is all over the internet. That drastic drop from December up until now in how many people are dying daily from COVID. I thought that was very, very compelling, because we know that one of the most significant things that changed in December, January is because we started getting more people vaccinated. We also see that separation because we started with vaccinating older people. We started seeing that a little bit of that separation. The cases that are going up now is going up the younger ages of people that are not vaccinated. So I am very, very excited that Pennsylvania has now opened it up to everybody, so that hopefully we start to see drop in hospitalization rates, drops in death in everyone, and not just older people.
Thank you for that. You say nerd, we say public health expert.
I think you're among friends, Dr. Cosbert. So I guess we'll just all claim the nerd card tonight.
Yeah.
You know, it's okay. It's okay. So you touched on, opening up widely so that any Pennsylvanian 16 and up is able to get the vaccine at this point. And we talked about the increase of supply, and really, tonight we wanted to get into access. And so one of the questions that has come in is, where can someone get the vaccine now in York City and its nearby areas? And then the second part is, are there plans to reach out to specific neighborhoods or groups within the city to make sure they have access to the vaccine? So Jenny, I'm going to toss this one to you, knowing that we have been doing some work in collaboration with other partners of ours in the community. And we have, as we talked about in the intro, a multi-pronged approach. So even if broadly, you can share some of the strategies we're taking. And then I know our team is putting some information in the chat about how to find providers in the community.
Great. And I'd kind of first and foremost refer everyone to a county-based website, vaccinateyorkpa.org, and we'll put that in the chat. But that's a place where, as at a county level, we've pulled everything together that will kind of with links to WellSpan, to UPMC, to Family First Health efforts, to special events. So going forward, if people kind of forget what we said tonight, if they go to that website, they're going to get pointed in the right direction. I would also say that we have, as a community, we have a good supply of vaccine. Is it adequate in every way? Probably not, but we have a good supply of vaccine. So the things that people were hearing a month ago, even about some shortages and supply not matching demand, we have all gotten much better at getting supply, using it effectively, and making sure that we can more closely match supply and demand. When you talk about the multi-prong approach, we have mass vaccination sites. So WellSpan in the County of York are sponsoring a site in the old AC Moore building. Haven't lived here that long, but I do remember when AC Moore was there. So out on Route 30. We have still sites at the hospital for WellSpan. And then specifically in the city of York, there is a collaborative vaccine clinic that's offered on Tuesdays and Thursdays. That's a collaboration between Family First Health, and we're hosting it at our George Street Center on the first floor, and WellSpan Health and the York City Bureau of Health. And we'll put up the phone number. You can call in anytime and make an appointment Tuesdays and Thursdays. And we are focusing on York City residents and trying to make access as easy as possible. And then I know each system is kind of reaching out and engaging also their patients in a variety of ways. So I would really say, people have asked me, should I wait for my provider to call? Should I, wait for a week ago, people were saying, well, how should I wait my turn in line? I would say for anyone who has made a decision that they want to get vaccinated, go to the website, find a place and time that works for you, sign up and get vaccinated. So we don't have those pressures around supply. It's everybody's turn, 18 and up, or 16 and up, I'm sorry. And so it's time. And this is our opportunity to really start to get protection at a community level so that we can resume some routine activities that we've all missed. And so that we can operate in ways that we might consider more normal. I'm also going to put in one last plug, and I'm sure our experts will back me up. It's not a time to throw away your mask yet. It's a time to, someday we might get to retire them, but it's not yet. And so keeping those behaviors in place, those habits that we've built, really, really important until we start to see levels of community vaccination rise to a place where we're seeing that overall protection. And to give you some idea, we have around 15% of York County's population vaccinated at this point. So we have a ways to go to get us to a place where we have what you may have heard of as herd immunity, or that overall protection at a community level. Dr. Tomi or Dr. Cosbert, is there anything you would add? Dr. Cosbert in particular, is there anything about your the way things are being handled in your office or with your patients that you would add to the availability conversation?
Yeah, just to echo kind of what you said, don't wait for your primary care provider. Do not wait for me. No, we have it's a lot going on. So we have the website, easiest if you're a WellSpan patient. My WellSpan, it's really easy to get a vaccine slot. Actually, right now there's a lot open. I just looked for someone else. It was great. If not, we do have a phone number, and I believe you guys are probably going to post that. I know that we are, of course, as she mentioned, we have the 2 sites, and we're all partnering with each other because this is that important. Like, the health of our community is the utmost importance. There's no rivalries. There's nothing like that. We're just trying to get this vaccine out to as many people as possible. And we do have a mobile vaccination plan in place. I don't know all the details about that, but to know that if you do have some issues with transportation or getting out of your house and being able to get somewhere, that's when you should be reaching out, because then your primary care provider might be able to set something up for you and get someone to come out.
Yeah, and there's that individual level, and then we are all working together around thinking about different specific populations. So there's a current initiative around looking at getting easy vaccine access to people experiencing homelessness. There's other efforts to try to really focus on some special populations that might be at higher risk for a variety of reasons. So I think we'll see more and more of those opportunities as we move through the month of May. And so just don't hesitate to reach out. Like Dr. Cosbert said, you don't have to wait for your primary care provider, but if you're really confused and just can't figure it out, please, all of us I know would welcome your calls to help you kind of navigate through if there's some special circumstances you need help with.
And Jenny, go ahead, Dr. Tomi.
No, it's not a big input. The pharmacies also are giving vaccines. I know I walked into my local giant pharmacy the other day. They are giving vaccines there as well. So call your local pharmacy if you can't reach anything or reach anyone, or just walk in. I'm sure you should be able to see somebody to help out.
Yeah, and that vaccineyourpa.org website has the pharmacies. I'm glad you mentioned that, has kind of every opportunity out there and with links to how you get to that information.
And that site also has some of the events that we've kind of termed as pop-up events, those that are surfacing, whether they be at churches, whether they be, there was the event today at the York Revolution Stadium. And so that site is really trying to keep up with anything and everything that's happening. At this point, I think we've made the point that nothing is perfect, but that's a really big step forward for York to have that one site. And if you still are confused, there's tons of numbers on that site. And as Jenny said, you can call any of those providers, and we are in such close contact that we're able to help route you. So don't let access be a barrier. We as, and I'm speaking for the entire healthcare community now in York, but I think I can in this comment that we are all working together to really, anybody who wants to get vaccinated, to get you to a place where you can get that vaccination. So if nothing else, that's a silver lining in this pandemic. And Jenny kind of chuckled earlier today. You know, I'm trying to look on the bright side of some of these things, that this is really challenged our systems to work together differently. And so it has the opportunity for us to function differently, going beyond COVID. So just call a number, pick a number, call a number, and you will be routed. If there's any question.
Yeah, and Anika, I think it underscores the kind of vision that we get to a new and better normal. The normal of the past didn't work for everyone. And so if we can emerge from this in a better, renewed normal that is more inclusive and more accepting and more collaborative, that will have been a silver lining of everything that we've all been through over the past, 14 months. So that may be pretty optimistic, but I I can envision that in the future, and I'm really hopeful that we'll get to that place where we can envision the normal that we want for everyone in our community.
That's right. And so we're getting close to time. And as with our last session, this was one of my favorite things to ask. So for both of the providers, Dr. Tony's starting to sit back. I like to give each of you a few minutes, a couple minutes to just give your final word. What would you say to the community right now about all things COVID? That if that was the only thing they heard tonight, that you believe would make the most impact for our community. So, Dr. Tomi, I see you nodding and smiling, so I'm going to go to you first, and then Dr. Cosbert, you have a minute or two to come up with what that is for you.
Oh, okay, I go now. So I've heard a lot of people say, I'll just give it a little bit more time. I'll just wait and see. Well, we've been waiting for a lot of months now, and we are still seeing the same effects. We started from just the 40,000, 30,000 in the trials. Now we're at 192 million people vaccinated. And we're still seeing that these vaccines are very, very effective. So lots of good news about that. Effective at what? Effective at reducing your risk of getting really sick from COVID, ending up in the hospital, or ending up dead from COVID. So very, very effective. We're saying that for the most part, they're very safe. And even when we've seen issues with side effects, we're seeing that the appropriate process is going on. People are watching this. We're looking at everybody that is getting the side effects, and they are responding to it appropriately. So I'm hoping that is actually something that gives you confidence in the process, that we're not just saying this out of blind optimism. We're saying it because we are watching what the science community is watching what's going on, and is trying to get all the information out there that helps you make the best decision. Everything that we go through in life is a risk to a benefit ratio. Every time you go out of your house and get into a car, there's a risk, or of getting into an accident. There's always a risk with everything, but we do it anyways. This is the risk of COVID, getting COVID disease versus the risk associated with this vaccine. I would really argue again that the risk of getting the vaccine is far less. So you're probably you have a better chance with getting the vaccine than if you decide to continue to wait and see. So I think now is the time. I'm hoping that you weigh your personal risk and make your personal decision. Obviously, if you have any questions, you can reach out to us or reach out to your primary care provider. Everybody, is trying to continue to keep ourselves informed so that we can answer your questions appropriately.
Thank you, Dr. Tomi. All right, Dr. Cosbert, what would your final word be?
So for me, I think it's been a year. We've been in this for 13 months now. Everyone has been affected by COVID in one way or another. And it's been rough for everyone. And I think, we all understand that. Some of us, are definitely involved in seeing it every day and having that risk constantly. And some of us, it's just massive changes to our lives. And as a society and as a community, we really need to stay in it and keep going forward and hope for that turnaround, for that something better, for the innovations that come to make things a little more tolerable and make things a little bit more normal and allow us to connect back with other humans, which is, something that has been affecting a lot of us. That's really important for our mental health, our physical health, everything. And the vaccine is one of those innovations right now that get us a little bit closer to that, to reconnecting, Because I mean, virtual is great. Yay, we can do it. Glad we have the technology. Couldn't imagine living 20 years ago. This would be unbearable, but it's not the same. So every innovation, every new thing that comes, we really need to grab onto it and see what can we do and how it's going to make a difference. And hopefully we can all do that together. Like Dr. Tomi said, waiting and seeing, it's at this point, be part of this first wave and don't be late to the second wave. And let's hopefully keep going strong.
Thank you. And you actually touched on a couple things that I'll underscore, both of you. We have to stay in this, because the weather is getting warmer. That's not the time to let down our guard. Those same precautions exist, whether you're vaccinated or not. The 3 W's, as we call them: wash your hands, wear your mask, watch your distance. And so we still need to remain on top of things when it comes to that. So I appreciate you both for underscoring that for us tonight. The other thing that I'll underscore that you mentioned, Dr. Cosbert, is the mental health. And that's something we've been having more conversations about, the impact on mental health of the pandemic and the isolation that this has caused for some people. And so that may be something that we discuss in a future session. So I do encourage everyone who tuned in tonight. I thank you for coming out. If you have topics that you think we should discuss, feel free to put them in the chat now, or you can email us at letstalkhealth@familyfirsthealth.org. I think that I got that right. Our team will put that in the chat for you. So thank you for coming out tonight. Thank you, Dr. Tomi and Dr. Cosbert, for being our experts and really helping answer our community's questions. And thank you to the community for coming out and learning more. We hope that you leave this session feeling more informed and with more confidence about where we are and where we're going as a community. The resources that have been shared in the chat, I hope that the community will take advantage of. The vaccinateyourpa.org site is an awesome resource. Again, we have several vaccination clinics going on throughout the county, so take advantage of those as well. So I'll bid a final good night to everybody, and thank you again for joining us.
Thanks, everybody.
Bye.